I'm doing a cranial nerve assessment. To test cranial nerve number 1, which is olfactory, you test the sense of smell. I'm going to have you plug one side of your nostril. Can you smell that?
Yes.
Plug the other side. Can you smell that?
Yes.
A positive test would be the inability to smell. Cranial nerve number 2 is the optic nerve, which tests visual acuity. I'm going to have you read that box right there. Can you tell me what it says?
Yes, it says Crayola 1903.
The positive test would be the inability to see the sign. Cranial nerve number 3 is ocular motor, which tests eye movement up and down. So you follow my finger without moving your head. Good. A positive test would be an inability to move the eyes up and down. Cranial nerve number 4 is the trochlear. To test that, you're looking for the eyes to cross at the nose when the finger comes closer. So follow my finger without moving your head. Good. A positive test would be the inability to follow my finger. Cranial nerve number 5 is the trigeminal. Close your eyes. Can you feel that?
Yes.
Does it feel the same on both sides?
It does.
Can you feel that?
Yes.
Does it feel the same on both sides?
Yes.
Can you feel that?
Yes.
Does it feel the same on both sides?
It does.
And can you also clench your jaw? Good. A positive test would be altered sensation on the face or inability to clench your jaw. Cranial nerve number 6 is abducens. To test that, you are tracking lateral eye movement. So follow my finger without moving your head. Good. A positive test would be the inability to follow my finger. Cranial nerve number 7, which is facial. You're testing whether they can do facial expressions. So can you smile? Can you raise your eyebrows? A positive test would be the inability to move or make facial expressions. Cranial nerve number 8 is the vestibular cochlear. You're testing hearing and balance. You can close your eyes. Can you hear that?
Yes.
Can you hear that?
Yes.
Which side am I on?
Left.
Which side am I on?
You're not.
You can open your eyes. A positive test would be the inability to hear. Cranial nerve number 9 is the glossopharyngeal. Can you swallow?
Yes.
A positive test would be the inability to swallow. Cranial nerve number 10 is the vagus nerve, which tests the gag reflex or the ability to talk or say ah. Can you say ah?
Ah.
And he's been talking, so he's fine. A positive test would be the inability to speak or say ah. Cranial nerve number 11 is the spinal accessory. Can you shrug your shoulders up for me? A positive test would be the inability to shrug. And cranial nerve number 12 is the hypoglossal. Can you stick out your tongue? Can you move it side to side? A positive test would be the inability to move the tongue.